Hi, welcome back to Gluten Free RN. This is Nadine Celiac, the Gluten Free RN. Today we're going to talk about your skin on gluten. This is episode 11 of the Gluten Free RN podcast. Welcome back. Hi, this is Nadine Celiac, the Gluten Free RN. Today on episode 11 of the Gluten Free RN podcast, we're going to talk about your skin on gluten and what that looks like and what it can feel like. Join me now as we review some of the very basics of gluten intolerance and celiac disease and some of the many ways gluten can actually affect your skin. This is just one way I've heard the effects of gluten causing a person's skin to feel like. It's like rolling in stinging nettles, naked, with a severe sunburn, then wrapping yourself in a wool blanket filled with ants and fleas. That sounds pretty horrible, doesn't it? Believe it or not, that's what dermatitis herpetiformis can feel like. Dermatitis herpetiformis is the rash that goes along with celiac disease. If you have DH, you have celiac disease. And you have to be 100% on a gluten-free diet for the rest of your life. Unfortunately, I have heard of people that were diagnosed with dermatitis herpetiformis, not told to go on a gluten-free diet. Some of them have been put on dapsone, which is considered to be an anti-infection medication or an antibiotic, depending on which reference you look at. So they're on dapsone for a very long time, but not told to go on a gluten-free diet. We'll talk about dapsone in a little bit because it has some very severe side effects. Really, the only treatment for DH or dermatitis herpetiformis is a 100% gluten-free diet. Why do I care so much about the skin and the effects of gluten? Well, I myself, as a nurse, I've had DH for a long time. And I still, even after 10 years on a gluten-free, now a paleo diet, I still have some skin issues, which tells me that my intestines are not completely healed yet. After 10 years. I know it sounds horrible. Dermatitis herpetiformis is caused by IgA deposits underneath the skin, and it takes a while for those to dissipate or to go away. For the most part, my rash is completely gone, except for 2 small patches on my right leg and now on my right arm. That's what another gluten exposure got me, was more DH on my right arm. Yay! Trust me, it wasn't a intentional gluten exposure, but I did get exposed to gluten last year, August, and now 15 months later, I still have the rash on my arm from that gluten exposure. Not anything I was looking for, by the way, of course. So, what is DH? Well, it's considered to be a component of celiac disease. It's a blistering vesicular rash, typically round. That's why it was named herpetiformis. It's not because it's related to any virus that would cause the herpes type virus, but it's the shape. That's why the herpetiformis name. So dermatitis herpetiformis is a vesicular, itchy, painful rash that the only treatment for is a gluten-free diet. So when I was growing up, at a very young age, I noticed it. I had little tiny itty-bitty blisters between my fingers, and the sides of my fingers would get rashes. The palm of my hand would break out into blistery rashes. Very tiny blisters, though. You could pop them, but it wasn't like they were large blisters, but it would get red and very, 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 very itchy and painful. But, I was a kid and I just assumed everybody had this rash because a lot of the women, especially in my family, had the same rash. It was misdiagnosed as many different things. I went to see too many dermatologists, and those are skin doctors, that diagnosed it as eczema, contact dermatitis, dyshydrotic eczema, many different things. And not one time in all of those years had any dermatologist ever said, let's test you for celiac disease, or that rash could be related to what you're eating. So my grandmother actually thought I was avoiding cleaning because anytime I put my hands in soapy chemical water or soapy, water even to do the dishes, my hands would explode with more rashes, more blisters. They would get red and swollen. I couldn't even bend them. So that rash went on for years. And I can only tell you that I went to see a lot of practitioners for it, and not once did it ever get identified correctly. After a while, I went to nursing school and I became a nurse, and I started to wear latex gloves. And I started to think that I had a latex allergy because my hands would just explode and with this rash and be very red and painful and swollen. But I saw other nurses with that rash, and I thought, well, it's just part of the job. It's just something that we actually have to deal with. And continued to go on. It wasn't until I was almost dead. I had multi-system organ failure, and I went to see one of the only dermatologists in town I hadn't seen. Her name is Dr. Abigail Haberman. And when I went in to see her, I told Nurse Helen pretty much at the time what was going on with me. My hair was falling out. My eyes were bugging out of my head. I looked like Marty Feldman. It's not a good look. Don't go for that one. But I had Graves' disease. I had fluid in my lungs all the time. I had chest pain. My arms and legs were intermittently numb. I looked like I was between 3 and 9 months pregnant, depending on the hour of the day. I had 4+ pitting edema, which means that I look like the Pillsbury Doughboy. Keep that in mind. And all my lymph nodes were swollen. So on top of that, I had the rash, which at some point before the year that I went to see the dermatologist had remarkably disappeared from my hands, but then exploded in other areas on my body. Interestingly, all of those patches that exploded on the rest of my body were different. So it looked like a different rash in different areas of my body. On my right thigh, I had a very linear rash, no real blister, but it was definitely red, extremely itchy, and very painful. Then I had my ass rash, which I talk about because it was on the top of both cheeks of my buttocks, or my dupa, as I like to say, because I'm Polish. I had elbows that were red and scaly, and also behind my knees were red and scaly and itchy. And I also had this patch on my foot. It's still on my right foot today, and I hope someday that it does go away. For some reason, it has settled on my right leg, and nothing I do at this point will make it go away. I think it's just going to have to go away on its own, which is fine. But for the most part, over the last 10 years, very quickly after going on a gluten-free diet, most of the rashes resolved, or they went away, they cleared up, never to be re-seen again in the same areas, which is great because nobody wants that rash. And it did cover the vast majority of my torso. Red, painful, itchy, it burned, and also, like when water hit it, it was painful. Trust me on that one. And very itchy, and nothing I did would make it go away. Unfortunately, because this rash is largely undiagnosed, a lot of people just think they have to live with it. Unfortunately, there's several documented cases of people actually killing themselves because of this rash, because there is no relief unless you go on a gluten-free diet. Steroids may work for a little while, but they're contraindicated in dermatitis herpetiformis and celiac disease. I spread tubes and tubes and tubes of steroid creams and other over-the-counter and prescription medications on my skin, all to no avail, because these rashes are caused from the inside out. So whatever's going on externally, whatever you can see on your skin is actually occurring internally also. So skin rashes, irritations, lesions that don't go away, that are chronic, are actually external expressions of whatever's going on internally. It's the same tissue. It's all epithelial tissue. So if your skin looks like that, there's a good chance that your intestines look like that too. And because your intestines or your GI tract starts at your mouth and ends at your rectum, that can show up in many different ways in your GI tract. Celiac disease is typically described as just occurring in your duodenum, which is the upper part of your small intestine. But the reality is that gluten can actually cause damage in any part of your GI tract, including your mouth, esophagus, stomach, duodenum, duodenal bulb, jejunum, ileum, colon, rectum. So some people just have hemorrhoids or they have an itchy butt, as they say, which can be very distracting if that's the case for you. And we really want to address these issues because medications are great if that's what you need, but we really need to look at treating the underlying issue or removing the cause of all the damage to your GI tract and thereby your skin. Unfortunately, many kids get put on long-term antibiotics for acne, but if that acne is really DH or dermatitis herpetiformis, what we want to do is avoid those antibiotics. And it's really not a good idea for anybody to take long-term antibiotics anyway. Tetracycline, doxycycline, all those medications are prescribed long-term, sometimes for years, for adolescents who have what is diagnosed as acne. If acne is on your back and your arms and on your face and your chest, it very likely is not acne. And what is acne anyway? So it really should be investigated before anyone is put on long-term antibiotics, which will disrupt the microbiome long-term, sometimes wiping it out, and sometimes putting people at risk for other infections like C. diff or Clostridium difficile. We really want to prevent the destruction of our microbiome and maintain it for a long life, number one, and because it helps our immune system. So taking antibiotics long-term is not a good idea. However, we know that dermatitis herpetiformis is influenced by hormones. So some women, when they get their period, will break out into acne, or the acne will get worse. There's a good chance that that acne is actually dermatitis herpetiformis. So dermatitis herpetiformis is influenced by hormones, and it's also influenced by antibiotics. So there's a lot of interesting information here as far as research on DH or dermatitis herpetiformis and how it's influenced and what causes it to get better, what causes it to get worse. And what we do know is that if you have DH, you have celiac disease, and the only treatment for that really is a 100% gluten-free diet. So I did a video in September 19th of 2014, and it's posted on YouTube, and it's entitled Your Skin on Gluten. You can find it on YouTube. You can look up my name. There's several other videos, most of them shorter, but this is a whole, at least an hour video on your skin on gluten. And as of today, interestingly enough, over 19,000 people have watched that video, which leads me to believe that there is a number of people out there that are suffering with rashes that don't know what they are, or they have been diagnosed with celiac disease and they are getting information perhaps that is incorrect, and they need more information on gluten intolerance, celiac disease, dermatitis herpetiformis, and how gluten affects your skin. So check out that video, write a review if you'd like, or contact me. I do consultations for individuals and families on all of these topics related to gluten intolerance and celiac disease. So the rash from celiac disease, which is called dermatitis herpetiformis, can look like many different things. One of the reasons I could not self-diagnose my rash is because it's misrepresented in every derm book I've ever read. And trust me, when I used to work in all of the emergency departments around the state of Oregon, I would visit the libraries and I would pull out all the derm books and I would try to self-diagnose. Because this rash really not only was painful and itchy, but it was distracting, which means that I could be doing anything else and still the number one thing on the top of my head was my skin and how much it hurt. Not a good way to live your life, by the way. So we really do want to identify people early because nothing will make it better other than a gluten-free diet. That's the only treatment for it. It can affect your skin on your eyes, on your legs, back, on your chest. It can be in your armpits. It can be on the back of your knees, on your feet. It's frequently described as being symmetrical, so it would need to be on both sides of your body, but that's not the case. I've seen multiple people with just a single patch on their back, or it can look like just scaly skin. It can just be itchy skin. So some people will literally only have itchy skin, no rash associated, but there's a good chance that that itchy skin, in the absence of a bug bite or poison oak or some other external cause, is coming from something you are eating, and most likely gluten or dairy. The only thing that will make that rash go away is adopting a 100% lifelong gluten-free diet. And I am a huge advocate for going on some variation of a whole food diet, also known as a paleo diet. Many practitioners and a lot of the websites will actually tell you it does not matter what you put on your skin. If what you put on your skin has gluten in it, it really doesn't matter. I will tell you 100% that that is not true. And I've had nice little conversations with dermatologists and people that are supposed to know better, and I don't know why they don't. But as someone that actually had to deal with celiac disease and dermatitis herpetiformis, I can assure you it absolutely matters what you put on your skin. As a nurse, we put medication on people's skin and we call it transdermal application, which means through the skin, because medications and everything you put on your skin actually gets absorbed into your bloodstream. That's what makes them effective. And so the gluten, even though it's a long chain amino acid protein, we as celiac people are sensitized to anything to do with wheat, barley, rye, primarily, but then anything else to do with those grains or other grains. So please be very cautious about what you put on your skin, both from the gluten standpoint and from the chemical standpoint. I'm very cautious now and very carefully choose my makeup, my mascara, my deodorant, any of my personal care products. All, number one, do not contain any grains, including white wheat, barley, rye, or oats. And I also avoid a lot of the other chemicals that I typically just assumed all of these personal care products had to have in them, such as paraffins and lauryl sulfates. A lot of the things I use now do not contain any of those chemical names or ingredients. So I use Primal Pit Paste for my deodorant, and I use makeup that's made by Zuzu Cosmetics. And I order my lipstick from redappleLipstick.com, and they make fabulous lipstick, by the way. I didn't even wear lipstick until they came out. And then I found out, oh my gosh, I really like this. And it didn't make my lips break out at all. A lot of the makeup or the lip balms, things like that would make my lips actually crack or swell or get lesions, sores on them. So nothing I put on my skin at this point is going to cause any breakout because I'm very cautious about what goes on my skin. Shampoos and conditioners matter, so I make sure that my conditioners and my shampoos are all gluten-free. The one I use right now is called Desert Essence Organics, and you can find it at just about any store. They all have it. You just have to look in different areas. What I find is that as Americans, we go into grocery stores and we pretty much just pick out the things that we're used to seeing or that we're used to buying. The reality is there are many, many more products out there, especially geared towards people that are celiac or need gluten-free products. So personal care products or food products. People with DH are advised to go on a gluten-free diet whether they have a positive intestinal biopsy or not. So you do not have to have proven intestinal damage because there's a direct correlation between DH and intestinal damage and celiac disease. Even if they can't find it, it's there somewhere or it's ready to be there. So that you don't actually have to have a positive intestinal biopsy to be diagnosed correctly with DH or dermatitis herpetiformis. Please keep in mind that dermatitis herpetiformis is not catchy. It's not contagious. Nobody can get it from you. It might be unsightly. It might look like a red, purple rash and be annoying to you. And, people may go, yeah, I don't want to touch that. It looks kind of icky, but it's not contagious. You can't give it to your family. You're not going to give it to your spouse. Nobody else is going to get it. The only way you can get it is to have celiac disease and then have this skin manifestation of eating things that contain gluten or putting things on your skin that contain gluten. So please keep in mind that, gluten can be anywhere and you really have to be very cautious about what you eat and realize that eating out is a risk. Trust me, I eat out. I don't live in a bubble. I travel quite a bit. Oh, traveling, by the way. I am going to lead a group on the Danube River in this July 2017, and we also have a planned trip for next summer. So if you're interested in doing that, not only am I an emergency trauma critical care nurse, but now I'm also the Gluten Free RN for the last 10 years, and I will be your leader, making sure that everything that you would be exposed to while eating and for personal care products is gluten-free. And this would be on Amaway Waterways, which is one of the leading beautiful luxury river cruises in Europe. And I had the benefit and absolute pleasure of taking a riverboat cruise a couple years ago, and I'm more than excited to do it again. And hopefully you'll join us for either this year, 2017, or 2018. There's my little commercial for the cruise this summer and for next summer, 2018. But it's important because when you travel, a lot of those sample size shampoos, conditioners, lotions that they make available to you are not gluten-free. And I make sure that that is all taken care of. I said that I would talk about Dapsone. Interestingly enough, I did get dinged with gluten a couple of years ago, actually last year. And my guts were in uproar, which they typically get to be in an uproar when I get accidentally hit with gluten. But then almost the unthinkable happened, and I had a systemic reaction to the gluten, and my skin once again exploded in ways that I didn't think were possible anymore. My skin hurt. It was on fire. It was itchy, like I could not believe itchy. And I called up my practitioner friend on a Sunday, believe it or not, and I said, and this is horrible, I said, if you could call me in a prescription for Dapsone, I'd really appreciate it, but if you don't, I will have to kill myself. That's how bad this hurt and was itchy and just drove me crazy. It was not tolerable. And I know how bad that hurt before, but I was completely reminded again of how bad I suffered. So thankfully, I have a fabulous practitioner who immediately called it in on a Sunday. I went and picked it up and started to take it. Now, prior to this, I had said I would never take Dapsone, that the only real treatment for dermatitis herpetiformis is a gluten-free diet, and I know that. But I was desperate, and desperate people do desperate things, and at this point, I considered Dapsone to be a reasonable thing to do. Keeping in mind, I was going to take Dapsone for a very limited amount of time because it has some extremely serious side effects, both for the blood and for the liver. So hemolytic anemia, that's when your red blood cells explode. So I didn't want to have hemolytic anemia where my red blood cells lysed or exploded. That did not sound like a good thing. Methylmyoglobinemia, agranulocytosis, and neuropathy. So dapsone is toxic to your blood and your liver, basically your body. So I had no intention of taking it for a very long time. Thankfully, it worked. And I only had to take it, I think, for 7 or 8 days. I still have a stash just in case. And my healthcare provider knows if I do call for it, I absolutely need a prescription refill. And I really hope I never need to take it again. But if I do, I will. And that is after having said I would never take it. So I had to modify even my healthcare plan. I just was not expecting to be hit dermatologically by gluten again. And I was a little bit shocked that it happened, but it did. And thankfully it resolved for the most part. Now the dapsone, interestingly, did not take away. It helped my leg. So I know that my leg is actually influenced, the rash on my leg is influenced by gluten and hormones and antibiotics. It is, in fact, DH, but the dapsone did not make the rash on my leg go away. But it did take away the overwhelming systemic, all over the body rash that was occurring due to the gluten exposure. So that's a lot of information just on the skin, and I hope it is helpful for all of you out there who are suffering with any skin issue. Be a detective, take this information, do some research. If you need any help, please call me. I know how frustrating it is to have a rash or to have signs or symptoms that are not taken seriously, so that we can actually hopefully figure it out if gluten intolerance or celiac disease are what is causing your signs or symptoms or your skin rashes or just your itchy skin, even just dandruff. Can you believe it? We really want to get to the bottom of what's causing these health issues, and your skin is an excellent tool to use as an observational tool to see how your body is reacting. My skin was not skin. It did not feel like anybody else's skin all over my body. It felt like a lizard. No amount of lotion or potions or anything else would cause my skin to improve. I really had to start eating correctly and make the rash go away. And then over time, my skin has improved dramatically. And it feels like real skin now. I like that much better. So that wraps up our episode, number 11, on the effects of gluten on your skin. Your skin is your largest organ, and we really want to make sure that it's taken care of and that we're paying attention to signs and symptoms that might just show up on your skin that are really caused by internal injury or something that you're eating or exposed to. Let's find the underlying cause. Thanks again for joining me, Nadine Griskowiak, the Gluten Free RN, and please look for the podcast notes associated with this episode 11, How Gluten Affects Your Skin, on the website. And if you get a chance, I would love it if you would do a review on iTunes or Stitcher or Google Player. Send me some notes. Put something on my website. Let me know how I'm doing as the Gluten Free RN podcaster. If you have any ideas for future episodes, please let me know. And in the meantime, stay gluten-free, stay healthy, build up your microbiome, and we'll talk more later. Have a great day. Bye.